Hi, I'm Dr. Christina, the owner and founder of Gentle Journey, the first in-home pet euthanasia service here in Arizona. So I've been doing this since 2004, and I've really picked up on patterns and common problems that pet parents and even the vet team have when guiding about end-of-life decisions. So we're going to talk about the quality of life chart. Quality of life is something that should be assessed your pet's whole life long. That's how you know if your pet is doing well. Understanding quality of life helps you catch disease earlier and helps you know if treatment is working. So quality of life is key to understand as both a pet parent and vet staff. I'm just going to make this quick video for you to help you understand how to use the quality of life chart. I am not a fan of quizzes and checklists. Those can be very confusing and give you the impression that good quality of life can outweigh bad quality of life. And that can get people into serious trouble. For example, I had a pet that had an extended abdomen because there was a tumor growing in the stomach area and extending, and that pet was happy, going on walks, loved treats, and doing all the things. And if you did a quiz or a checklist, it wouldn't look like it's time to euthanize that pet. But if those people waited any longer, they would have been in a serious emergency. So that's why it's important that we don't use checklists or something to add up good quality of life versus bad quality of life. Same with good days versus bad days. That was always a common advice. Pay attention to when they have more bad days than good days, it's time to euthanize. That's not necessarily wrong. That just can be dangerous because many pets do very well, just like this dog with this growing abdomen mass, until they don't. So you don't have time to wait. Sometimes that first bad day could be the sign that an emergency is coming. So it's more complicated than that, and that's why I wanted to make this video and create more tools around assessing quality of life, because it is more complicated than a simple checklist. And I'm sure you know it. If you're in this position right now, you know how difficult this decision is, how heart-wrenching this decision is. And I know that you want to get it right because you love your pet and you feel responsible for their life and their peaceful death. I get that. So that's why I'm here creating as many tools and resources I can to help you. So I created a chart versus a checklist or a quiz. And what the difference is, if you don't have this chart, maybe you're on this video because you've gotten this chart at your vet clinic or at your groomer, but you can also get a copy on our website. You can download a PDF of this chart. And how the chart works is, similar to quizzes and checklists. We're going to look at different areas of your pet's life. But if your pet is poor in any one area, whatever box they land in, no matter what is happening up here, it's poor quality of life. Okay, so for example, your pet could still be interested in going for walks, getting pets, going to the bathroom, eating. But if your pet is skin and bones, your pet is in the poor to suffering quality of life box. That's how it works. So I wanted to really streamline it so that we don't ignore, doubt, second guess clear signs of suffering. And I get that that is one of the most confusing things about dogs and cats is their ability to cope. Your dog's ability to be excited to go for a walk, but maybe they can't make it as far as they used to. You have to pay attention to that and not be deceived by their excitement. If they are ravenously eating, it may look like they're getting enough nutrition, but if they are skin and bones, they are starving, period. Doesn't matter how much they're eating. If their body is deteriorating into skin and bones, and you're seeing the bones along their back or their hips or their head, they are slowly starving. And starving is not only painful, it's dangerous. Many of the pets I see who have been starving and acting loving and interested in doing things get to a point where all of a sudden they become comatose, and then it's an emergency, and you don't want to get to that point. So really understanding quality of life, understanding the significance of some of these boxes, but also understanding disease progression. I like to think of it as a tidal wave. Like if your dog, or we'll say cat, even though cat's never going to be playing on the edge of a beach, if there's there's a tidal wave coming, they have no idea. They're having a great time, but you see that tidal wave coming, you have to protect your pet before that tidal wave overtakes them. And that's how disease progression works. If you're noticing signs of their disease progressing, kind of like the abdomen, the belly extending in that one dog, even though they look like they're happy and enjoying life, but you see something's about to overtake them, that is your responsibility to take care of that before it wipes them out, before they experience that pain and suffering. And you know, there's no blame, there's no guilt if you got it wrong in the past, if you get it wrong this time, because to be honest, there really is no right or wrong. What we're doing is getting as much education to make sure our pets are not suffering. Because while it is absolutely your personal choice how much diagnostics and treatment you want to do for your pet, that is not what this video is about. There is no guilt here. It is your responsibility to make sure your pet doesn't suffer. That is your responsibility. And in a lot of states, that's even a legal responsibility. Allowing a pet to go on suffering without doing anything can be a federal offense in different states. So you do have to take that responsibility, and I know you want to. I know you don't want your pet to be suffering. It's just sometimes we're fooled by their behavior. So that's why I've created these tools. Hopefully this chart will be an eye-opener. On the back, there's a mindset quiz, or it's also in your quality of life toolkit, because as you know, this is a very emotionally difficult decision. And our emotions can get in the way of us making the best decision. So that's why I've created this mindset quiz to hopefully give you the help you need as you're making this decision. If you need more support, we have articles on the website, and then also I created a full simulated in-home consult for you where I act like I'm sitting down in your home and explaining everything I would explain to a client. It's about 90 minutes. It's divided up into 5 videos. The most important, if you just want to get in there, are videos 2, 3, and 4. I go through how to really assess all these areas of quality of life for your pet. That's available on the website, and then you can always schedule a one-on-one consult if you need to. So I hope that helps.